Hi, my name is Manu Multani, and I am a ABD in anthropology and social change at the California Institute of Integral Studies in San Francisco, California. I am presenting a topic that is very near and dear to me, and it has to do with how to incorporate ethnographic methodologies in public health research. And I wanted to explain where I'm coming from with this presentation. I am a student of anthropology who recently uh, embarked on exploring field work in Punjab, India, specifically in Chandigarh, Punjab University, where my research question involves um, understanding decision making processes and sexual scripts um, amongst youth as it relates to their sexuality. And I really wanted to approach this from a not only a creative standpoint, but also utilizing methodologies that kind of drew in um, the different ways in which I have explored relationships and community building and grounded community research in the past. I have a master's in public health and global health, um, and I've worked in that industry or that sort of section of sexuality and sexual health for a number of years, and find anthropology to have a bunch of solutions that I think are very valuable to the work of public health. So, the intention of this presentation is to really understand how, like, multimodal research methods can be considered in public health research, not just locally, but also globally, and especially with issues of sexuality. So the objectives of this presentation are to offer a unique perspective, diving deeper into sort of the undercurrents of a causality of a health issue by using these research methods, um, and understanding that visual ethnographic methods also give us an opportunity to build intimate relationships with communities and to really understand how social determinants of health operate within communities. Um, and furthermore, it gives us more engaging material to kind of put out in the world, whether that is because we're representing institutions or um, we also want multimodal platforms to publish our work. So, as a researcher, as a scholar, as a practitioner, having different modalities of your work is all the more advantageous in today's world, especially as we're trying to build our social media presence and or publish in different um, publics, including magazines and news agencies that are now more focused on bringing in these disciplines and the strengths of these disciplines to make um, general audiences understand the complexities of issues. And that could be very useful and relevant and far reaching when it comes to sexuality. So, the methodological approaches that I tapped into are centered around multimodality, where it really kind of centers how media production could influence understandings of everyday life of not just the ethnographer, the anthropologist, the researcher, but also our interlocutors, our participants. And so it becomes a medium that actually functions throughout your research to offer insights that maybe just interviewing or just need assessing, sort of to use the nomenclature, the sort of ways in which we engage public health research may be missing. Um, and ethnography in general is about participant observation. It requires us to really be alongside communities and within communities versus top down or bird's eye in these scenarios. And it also requires introspection, like how is sort of our position, our positionality, our experiences influencing the way in which we understand things, and um, in a way that offers a different level of nuance that is also a very unique difference between doing ethnography and doing public health research, where public health research is a lot about standardizing. But ethnography is really about real lived experiences and authentic storytelling. So I grounded myself in a various number of theories, especially feminist theory is first and foremost and center. It really helps me in terms of approaching sexuality studies from from a way that is very much less universalizing and less standardizing, but rather open and engaging in the variety of ways in which we all engage sexuality. And I also tapped into public health theory and practice because of my previous experiences. And just to reiterate that it adds a whole level of nuance when you're able to not just be multimodal in terms of using photography and film and different and poetry and art in sort of understanding and engaging in communities, but also being multi theoretical and multi practical in a way where you can use these different modalities to kind of help you engage in a community in a more richer sense. So there are some limitations. It's your perspective at the end of the day. If you were to use, film and sort of like how you were behind the camera and how you sort of influenced that frame, the responsibility does fall on you as a researcher as it does anywhere else, I guess, to be as completely honest and authentic and true to what you had captured and experienced. Um, and so that could also be a pitfall where you find challenges in doing that because there's a certain narrative that you are trying to adhere to and communicate. So this sort of work really requires us to kind of shift our intentions and change our emphasis when you are trying to incorporate multimodal sort of approaches to public health research. Um, it really requires us to engage and ground ourselves alongside and within rather than from top down, which often happens in the case of public health research. And it also requires us to kind of dismantle the ways in which we think we're the rightful owners of knowledge and acknowledge that we are trying to co produce knowledge. There's something that is centering learning and co learning, and also really trying to embed relationships as the center of trying to understand any form of public health, whether that be just sexuality education and how that's implemented, or whether that's access to contraception, or other ways in which we engage with sexual health and sexuality within the domain of public health. And so it really requires us to acknowledge that there is something that we do to knowledge and as we work with communities, and that we really need to shift our intention and recognize that we are not the rightful owners of this knowledge and that we should not co-opt this knowledge, but rather really co-produce knowledge and really figure out on how we can push prevention and other goals that we are often trying to achieve when doing public health research. Um, and so this sort of offers the opportunity to really be relational and acknowledge the complexities of people's lives through multimodal ethnography. um, so I did the origin sort of one of the ways in which public health research also operates is doing one-on-one qualitative interviews that are structured with a questionnaire and with the right like sort of language capacity, and also um, uh, giving opportunities for people to remain anonymous with pseudonyms. So that's very much the sort of similarities across my research. But the additional thing I did was I captured my field notes through photography. And I also filmed my interviews. And I also filmed my interlocutors and participants in the field. How are they as students? What are they doing? What does student life mean to them? And I think that also helped me build a better relationship with them over time, and B kind of preliminarily gives me the opportunity to now go back and to do more deeper investigations as it relates to sexual script theory. Um, and so it really was a tool in which I can relate and establish relationships for the longer term. So, what is it that field notes offer that maybe an interview or an assessment doesn't? Uh, it helps us understand life's complexities. It helps us understand the factors that are influencing daily decision making. It gives insight into their politics. It tells us about the built environment in which they're navigating their lives. So overall, it really gives us a deeper insight on how lives are actually lived and how the built environment really influences one's way of navigating their life. And as we try to understand sexuality, which is such an intimate topic and requires intimacy, um, these sorts of aspects are so much richer and so much more direct towards understanding sexuality and sexual health. Um, and so it really helps us bring the authentic um, to the fore. And usually using visual methods really helps us sort of highlight that in a unique and authentic way. Here are my references, and if you wish to reach me, I included my email and Twitter handle on the front slide of this presentation. Thank you.